I'm Dr. Nadeem Sajjad Raja. You are watching my YouTube channel, Dr. Raja Nadeem Sajjad Official. Please do subscribe my channel and press the bell icon button. In this video, this is the third video on congenital infections in newborn. Today I'm going to talk about congenital cytomegalovirus as well as congenital rubella virus. Congenital cytomegalovirus is a group of symptoms that may occur when an infant is infected with the cytomegalovirus before birth. Most infants who are infected with this virus never develop signs and symptoms of this disease. However, approximately 10% of babies will experience health problems or disabilities. For example, problems with the lungs, liver, spleen at birth. Some may suffer with hearing loss. Some experience vision loss, intellectual disability, seizures, small head size, and lack of coordination. Some babies with this condition may have evidence at the time of the birth, or other may not develop any sign and symptoms for 2 or more years. Congenital Cmb infections, Cmv is a cytomegalovirus, occurs when a mother gets infected with cytomegalovirus during the pregnancy and passes this infection to the fetus through the placenta. So what are the signs and symptoms of congenital cytomegalovirus infection? Symptoms will vary from patient to patient, or we can say person to person. 80% to 99% of patients have abnormality of vision. So definitely they will have issues with their vision. They will also suffer with hearing loss. 30 to around 79-80% people, patients will have low number of red blood cells as well as hemoglobin. Their liver and spleens will be enlarged. These patients are usually very slow and their growth is not really optimal. The mortality rate is as high as 12%. Within the first 6 months of their life, mental retardation is also very common sign and symptoms of congenital cytomegalovirus. So how it is diagnosed? Isolation and culturing of the virus from oral secretions or the urine of newborn can help to determine the diagnosis of congenital cytomegalovirus infection. Polymerase chain reaction, that is a molecular method test. So that polymerase chain reaction or PCR detects cytomegalovirus DNA in these samples. So it's very important to establish the diagnosis as quickly or as early as possible, as soon as the doctor suspects that there is a congenital cytomegalovirus infection. So treatment is usually, after the confirmation of the diagnosis, there is a one intravenous antiviral agent which is called as ganciclovir that is given. Also another antiviral agent, ganciclovir, that is also used. Cytomegalovirus vaccine is under development. So just let's recap the signs and symptoms of congenital cytomegalovirus infection. So symptoms which are present around 10% of babies at the time of the birth. So they are born before the time, so they are premature. Their liver and spleen are enlarged. So their body size is small. Their head size is also small. They suffer with fits or seizures. 50% patients who are infected before the birth with cytomegalovirus, they suffer with hearing loss as well as loss in vision. their developmental delay is also common, as well as fits. So what is congenital rubella? The incidence of congenital rubella infection has dramatically decreased after the introduction of MMR vaccine, measles, mumps, rubella vaccine. Nowadays, very less cases are reported as compared to cases in late 60s as well as in 70s. The severity of fetal involvement is dependent on the time of maternal infection. If the maternal infections occurs within the first 8 weeks of pregnancy, so it is usually associated with miscarriage, spontaneous abortion, or fetal loss. If fetus is infected before 11 weeks of gestational life, then it affects a lot of organs. But after 12 weeks of gestational life, only deafness and retinopathy is reported. So what are the common clinical features or signs and symptoms of congenital rubella? Newborns with congenital rubella are often asymptomatic at birth. The early clinical features of this disease include generalized lymphadenopathy. Their liver and spleens are enlarged. They suffer with jaundice or hepatitis, and platelets are low in their blood. These features usually resolve within a week. So what are the common complications or long-term complications of congenital rubella? So the most important are sensory neural deafness, cataract, mental retardation, diabetes mellitus type 1. Affected individuals or affected newborn should be considered as effective until the 1 year of age, because they keep shedding rubella from their secretions. So how congenital rubella is diagnosed or detected in newborn? Isolation of rubella virus is successful up to 1 year of age, as I mentioned, because babies keep shedding this virus. Sample from nasopharynx or cerebrospinal fluid or the urine can help in the isolation of the virus and establish the diagnosis. After establishing the diagnosis, there is no specific treatment for congenital rubella infection. But prevention is very important, and prevention is always administration of measles, mumps, rubella vaccine. So what are the primary infection signs and symptoms? The patients usually suffer with low-grade fever, headache, red eyes, cough, congestion, and there are spots on the body. And typical signs and symptoms of rubella infection, congenital rubella infection in newborn: cataract, deafness, and cardiac defects. That means their heart defects. Please watch this video and pass on to other people so they can watch this video. If you have any question, write down in the comment section. I will answer your query. Thank you very much.